Cancer is such a unique journey.
I didn't feel a thing, which actually scared me even more.
There's no age which you can say you have to start checking your breast at this age.
What if I don't survive?
I had no idea that there was more than one kind of breast cancer.
To do the scan, you become radioactive almost.
Wow.
I was like, oh, I'm like Spider-Man.
Welcome to the She Word, conversations that women rarely have but really should. Firstly, welcome to this live edition. This is absolutely amazing. We're here at the Mercury Towers to shine a light on one topic that potentially may affect you personally, and if it doesn't affect you, it's certainly going to affect someone that you care about. Across the world, breast cancer is the second leading cause of cancer death in women. Only lung cancer kills more women each year. The chance that any woman will die from breast cancer is about 1 in 40, about 2.5%, thankfully. Women in the US have a 1 in 8, or about 13% lifetime risk of getting breast cancer. This means for every 8 women in the US, 1 will be diagnosed with cancer, breast cancer, during their lifetime. In Malta, over 300 people are diagnosed with breast cancer every single year, making it the most common cancer on the Maltese Islands. On the other hand, there is a good chance of recovery if it's detected at an early stage. And whilst the good news is that breast cancer death rates have been decreasing steadily since 1989 for an overall decline of 42% through to 2021, this is still a topic that I think very few of us really understand and know about. So we've got the opportunity to team up with the guys here to really make a difference with this show, because we want Pink October to be more than the pinkification of a woman-related issue. We want to have meaningful conversations. So on this live edition, I am thrilled to be hosting 2 amazing breast cancer survivors here to tell their stories, and 1 expert who's going to be guiding us on what to look for and what we can do. As I mentioned, this is also a live show, and so I'm really delighted that we have people here with us, and we'll be giving them the opportunity to ask questions at the end. So first of all, I want to introduce my guests. I'm so glad that you're all here. Thank you so much for taking the time. Lorinda Mamo joined us on the She Word in, I think it was season 2.
Yes.
On your powerful show, specifically relating to women and health. And you shared your story then about your breast cancer journey. You've also spoken at our live conference and also other editions of the She Word. We're so happy to have you here, Lorinda.
Having me.
So good to be sitting here with you again. Monika Schembri, hello.
Hello.
Hello. You are really somebody that I fangirl over because your story is just incredible. It's just absolutely amazing. You were on the show Separation and Divorce. Your journey related to a very painful breakup, but it also threw into the conversation that you are a breast cancer survivor, that you were dealing with that before you had your separation. So you already had that going on in your life as well. And you had a newborn baby and 2 other little ones. We have one of them here with us today. I'm really delighted about that. So I'm going to be talking to you about your journey as well. And I'm so glad that you're here. Thank you, Monika. It's always lovely to see you.
Thank you. Thanks for the opportunity to be here.
Well, Mariella Smeir as well is a breast cancer nurse navigator. What a title. I'm so glad that you can be here, Mariella. You are also a mum, and of course you are a woman. So you already share some good points with these ladies here as well. You've also worked at Sir Anthony Mamo Oncology Centre, which is an advocate for Pink October, Movember Malta. So you come to the topic both with an academic knowledge, but also lived experience, compassion. You have been dealing with women who are dealing with breast cancer.
Yes, exactly. Thank you for the invitation.
You are so welcome, and I'm so delighted that you're here. So before we start discussing this topic from any academic or from medical point of view. I really want to hear a little bit about these ladies' lived experience stories. As I said, it's so good to have you here. And I'm going to start. Monica, you look slightly nervous because you're sitting on a stage in front of people. But so I'm going to throw Lorinda under the bus first and just say, Lorinda, you've shared your story so many times, but for this show, for our story, for Pink October, tell me exactly your journey with breast cancer.
So I think my journey is a bit different from other journeys because I was also dealing with my medically complex son. So it really took me, I don't know, for a loop, I guess, because it was already something that we were going through hospitals and medications and treatments and doctors and everything. And then, things were they looked like they were settling. And I literally just did this. And, I felt like a cold sweat. And I said, nah, this isn't happening. There's like this feeling, And I called my sister and she said, don't worry. She said, it could be hormones, it could be milk, it could be anything. And we'll just do an ultrasound because my sister's a doctor. So she said, let's just be on the safe side and schedule an ultrasound. And I went to the hospital and I hear the clicking of the heels. And I had already learned that when you hear those clicking, it's like, the big one's coming. It's like, otherwise, I could tell the nurse, her face was changing. And I was like, okay, this isn't good. And she comes in and she says, listen, she said, I don't like what I see at all. And she said, you need to do a biopsy. She said, I can either do it now or I can do it. You can schedule to come back. So my son was already at home with my husband because I said, don't come because I just want to go quickly. Don't bring our son again to the hospital. And so she did the biopsy. I said, do it now because I really just want to know so I can get on with it. And she did the biopsy and she said, okay, you have to wait. And those were, I think, the hardest days just waiting for, you don't know what's going to happen. And then the results came out that I had grade 4 breast cancer.
Okay, so for anybody who doesn't know, which is me, grade 4 is what?
It's very advanced.
Oh, wow.
So then what they have to do is they have to see how far they do the scans to see if it's traveled, how far it's traveled, if it's gone to any other organs. So then they start, because it's not, I mean, I learned as I was doing it as well, because it's not just, okay, breast cancer, take it out and that's it. They won't know if it's traveled. So I, in fact, had to get the cancer out of my breast and then the lymph removed from under my arm. And now I also have like a pit, like literally like a hole under my arm, because they have to remove the lymph nodes so that it doesn't travel to the rest of your body, because the lymph carries to the rest of your body.
Okay. So I got a couple of questions. Just, I'm going to do this. I keep stopping because I know we're going to ask Mariella also about the lymph nodes and everything else, and also about the journey of cancer. But coming back to your personal story, you literally, and I'm always curious about this, and it's one of the things that we're going to talk about. You literally put your hand under your arm.
It was,
and you felt a lump.
Yeah, I felt it like on the side of my breast. And then it ended up that there were actually more than one lump. It was the one more that was further in. But I was lucky. And they told me several times, you were lucky that you found it when you did.
Okay, so I'm going to continue being a little bit basic about this, because I don't remember the last time I put my hand under my arm. I mean, it's not something that we normally do. And it's certainly something that we're going to be talking about today, for what we as women can do to be really proactive about breast cancer, because obviously the statistics show that it does affect us women, and that this is something that we need to be looking at. But you would just happen to be, I don't know, putting your bra on or something like that.
I was holding my son and I had like an itch and I did that.
Oh, wow.
It wasn't intentional.
So you found out you had grade 4, which is very progressive breast cancer. And of course, and you've still got a young son at this time.
Yes.
And this is what we need to throw into this. It's not even like a kind of an easy day. You've just got a young son, and they tell you this, and they also tell you that it's spread to your lymph nodes, so this needs to be removed.
Yep.
Then what?
Then you have to do, I remember I had to do like this scan, I forgot the radioactive, she could tell.
That's good.
Yes, and you have to like, they put this dye in and you're radioactive. Like I found a lot of it really funny, really amusing, because they're like, you can't, if you go to the bathroom, you can't go to the bathroom near your child because your pee will be radioactive.
Oh my good grief.
I had to stay away from my son for like 24 hours because I was like, couldn't go anywhere near anyone pregnant. Yes. And I was like, oh, well, this is all new. And this is weird. And it's like, it's what you have to go through. So to do this scan, you become radioactive almost.
Wow.
I was like, oh, I'm like Spider-Man.
So after you've had this scan.
And then it starts, like the journey starts. Okay, so then they have to decide, do you do surgery? Do you do, where are they going to remove it? Or do you go to chemo? So they decided to do the surgery and then do chemo. When they started to do the chemo, they realized that my veins were really bad, so they wouldn't be able to do. And then I had to get Portacat in my chest, and it would literally just make the insertion of the chemo easy. So it's like a little plastic button inside, and then it goes straight to your artery, and they give you administer the catheter, the chemo through that.
All of it sounds incredibly frightening, and it sounds very scary. I'm going to ask you, did you also, obviously you went through your journey, and I'm kind of skipping a little bit. Did you have therapy? Did you actually talk to somebody about this? Because this is, you've just had a newborn, and this is terrifying.
I was still at Boffa when this was, a lot has changed. Someone did call me to offer therapy. Unfortunately, the timings were really bad, and because I was taking care of my son, trying to manage him as well, so his care, and then it just never materialized.
Monika is nodding over there, and I'm going to come to Monika's story in just a second. But where are you at right now with your breast cancer journey?
So now I'm still on preventative medication, and I also, in order to take the preventative medication, I am in induced menopause.
Okay.
So I get an implant every month inserted to be able to take the medication for.
And this is for how long, or this is indefinite?
Indefinite.
Wow. Okay. But everything with regards to the cancer.
Yes.
Thank God. I mean, I'm so pleased, and you're very, very outspoken about this. We're going to come to more of your story in a second, because I want to come to the human part of it, of course, which is how it affects you personally and how you go on to live with this. But Monika, you also are a mum, and this was very timely for you as well.
Yeah.
Because, correct me if I'm wrong, but you had a newborn.
No, I had two sons at that time, 2 years old and 4 years old. Myself, I was pretty young, I would say, 32 years old when I was diagnosed.
You were how old?
32.
You were 32, and I forgot to ask you, Lorinda, 38 and 32. I mean, this is in your 30s.
Yeah.
Okay.
Like, obviously, I never imagined or what in my life, like, this is going to come to me. No family history, not even friends around. Like, I was not aware about the thing. Like, I just hear the thing, Pink October, you hear breast cancer, but like, if it doesn't affect you, it doesn't affect anyone around you, like, don't think about it. So, it's very similar to Lorinda's story in a way. We have totally different breast cancers, but it was the same. Like, I never checked myself, and it was very intentionally. One evening, as you said, like, I felt an itch, just kind of itched, and then I felt like a big bump, like a big lump. It wasn't like a little, but it was like, oh, what's that? Like, it came out of nowhere, literally. Like, what's that? And at that time, I was telling my husband, I took his hand, I was like, feel it. I said, what is this? You know? And he was like, all right. I said, okay, that's weird. And I just left it at that. Next day, I was talking to my mom on the phone, and I was telling her that this lump, a bump. I said, it's better I go in and check, And she was like, yes, go and check. And I made an appointment for ultrasound, and it felt on a day, on the same day when we had to go on holidays. So basically, we had to leave on holidays in the afternoon, and I had an appointment in the morning. And I was thinking to myself, because I didn't really take it seriously, to be honest, I said, I'm just going to cancel it, because it was so busy that day. I said, I have kids to get from school. I have to go this and this and this. I said, it's too much for the day. So I canceled it. I canceled it myself. It was 2021 July. It was still COVID times. So I canceled it myself, went on holidays, 2 weeks holidays, nice and all good. Came back, I rang again to make an appointment, and they gave me in 2 weeks' time, which was September. I said, okay, fine. At that time, actually, the hospital rescheduled appointment. They rang me and said, doctor is not available, can we reschedule it? I said, okay, fine. It got rescheduled to October. So my first ultrasound, I remember, it was 8th of October, 2021, when I went to do it. And I will always going to remember the day. I already knew it, I think so, in my heart. When she checked, she said, okay, we have to look at this more deeper. You need to come for biopsy. But my heart is racing already. I'm remembering.
Oh, wow.
She said, you have to come for biopsy. And I said, okay, when do we do that? She said, I'm going to do it next week on Mother Day. And the wording she said, this is what it caught me. She said, I think so, you waited long enough. And This is where it clicked to me. I said, okay. Also, what she said to me, she said, listen, would you mind if you go and see, we have a surgeon at this time, because in case you have to do something, you're already going to meet him. And I was like, yes, okay, so why not? Like, I'm already here. Like, of course, instead of coming back in and out. And I had my kids and my husband at that time outside. It was COVID time, so he couldn't come in. I was actually on my own. So I rang them. I said, listen, guys, I need to go and see the surgeon. I'm going to come soon. When I went, it was Dr. Juice. When I went to his office, he actually asked me, he said, you alone? I said, no, my family is outside. And he told me, bring them in. And this is where my heart started racing. Tears started to come out.
I'm tearing up.
I was like, this is not happening. Like, but you already know in your heart, like something is happening. And from that day on, basically said, okay, like we still have to wait. They didn't know it because we still have to wait for biopsy results to come, like around 1 week or so. But the big chance, and we have to tell you what might happen, this and this and this and all the facts and what can happen, chemotherapy. And I'm like, okay, but it's like, it's okay, I still have to wait. As Lorinda said, that week of waiting, it's a torture. It's a torture. There's a lot of thoughts go through your head, but it passed. And when I got the results, yes, they confirmed they found cancerous cells. And the journey started. And the journey started very, very fast, actually.
So can I ask you, because again, there's a lot of things about these stories that I'm not aware of. Yours was stage 4. Do you have
yes,
a particular stage?
Mine was different. Mine is not hormonal cancer. Mine was triple negative breast cancer, which as well was grade 3, which is pretty aggressive. However, probably Miriam can tell me, triple negative, it's kind of already more aggressive kind of tumor. So has to come with like really, really straightforward, effective treatments, like aggressive treatments, because it travels pretty fast. So I think so that's why maybe my lump, because I said like, how come I never felt it? Like it was just here. It's not somewhere under my arms. I said, how come I never felt it? It just came out of nowhere. Because I think so it's already the type of cancer I had, the tumor grows faster. So yeah, it was grade 3. And again, the doctors a bit different aside from Lorinda's. I had to go through chemotherapy first to shrink the tumor because it was too big. So we had to shrink it with chemotherapy, then to have surgery removing lymph nodes, and then radiotherapy afterwards.
Well, I have a ton of questions, and I'm going to do what I always do on the she word. I'm going to throw the script out right now because Were you talking of just really prompted me with a bunch of different questions. Do we have any other breast cancer survivors here?
Yes.
Can I just a round of applause for breast cancer survivors? I'm listening to these stories and and honestly, I'm getting choked up because I can hear how much this still means to you, that moment where you were told. But I want to start by asking Mariella, these ladies are talking about for triple negative, grade 4, grade 3. I know nothing about any of this, but one thing that's stuck in my mind, and as I said, I've thrown the script out. One of the things that stuck in my mind is that both of these ladies reached and felt a lump, which, we kind of think, well, wasn't it there before? How could you have missed something that important, something that big? I know that cervical cancer can take up to 10 years to develop. That's why we have a smear test every year. How fast is breast cancer? It sounds to me as if it's extremely aggressive, that one day you could be feeling and you see nothing, or one day that you brush and the next day Monica's going like this, or Lorinda's just going like this and feeling that she has a cancerous lump.
Yes, as they were saying, there are multiple types of breast cancer, so it depends on when you hear breast cancer, everyone thinks that is just one breast cancer, but it doesn't. No, it's not that way. We have mostly 3 types of breast cancer, which are the hormone-positive breast cancer. That is the most common breast cancer, which usually affects women who are above the age of 50s and 60s and older people. So that is usually less aggressive because it usually comes with age. So that is quite different from the other cancers. Then there are another 2 types of cancer. One of them is the triple negative breast cancer, which is 10% of the whole breast cancers that exist. It is quite aggressive because when we're actually dealing with cancer, what we will be looking for are what we call receptors. Receptors we call them these like antenna on the cancer cell, which for us, it indicates what the cancer cell needs to grow. So in case of estrogen receptor positive, we know that the female hormone, the estrogen, is one of the food that the cancer cell uses for that to grow. So we say that we actually know what we can give the cancer to stop the process. In triple negative breast cancer, we know that all these receptors are not there. So we know that the cancer cell grows by itself. So it replicates through cell division like all the other cells, healthy cells we have in our body. But in this case, the DNA will just change and the cancer cell will, during the cell division, which is the normal process of a cell, it multiplicates and it grows into a cancer. So yes, usually triple negative breast cancers are grade 3. So when they're mentioning grades, it's how fast does the cell grows. So we have from grade 3 to grade 1 to grade 1 to grade 3. The grade 1 are the slower cancers. Grade 2 is in the middle. Grade 3 is the fastest that it grows. So that's why Monica was saying that she actually never felt anything, and all of a sudden she had this lump that she felt.
So we're talking about maybe weeks or a month, or how fast could that grow?
You can't know exactly, but usually sometimes it's just, at first it will be just a bit of a bump in the breast, which sometimes we have patients who actually see changes in the breast, like there can be redness in the breast, there can be nipple discharge, there can be sharp pains, but no, like if you have pain, that is alone is not enough. So usually you'll have pain associated with a lump, or you have nipple discharge, or you see a dimple in the breast. So then also it depends on the size of the breast, since if it's smaller, you're going to feel it easier. If it's a big breast, it will be much harder to feel because it can, to feel it will be much more difficult.
I have to tell you, I'm suddenly becoming very, very self-conscious. And I'm suddenly thinking we all need to go home and just check our breasts.
Yes.
Which, of course, is one of the reasons that we're doing this show, because we want to. But in the case of either of you, did you have any discharge or anything other than a little bit? You mentioned itchy. You mentioned there was a bit itchy.
Hello.
There you go.
No, I don't think so. No, now when I look back, I think so. It was like I just kind of wanted to touch it, and then I realized it. But other than that, however, I don't know, because I think so in our routine, it's so busy. I have 2 small kids, like you don't think about the things. If there is a little, I don't know, redness or something, it's like whatever. Like you don't pay attention to it. Like there was stuff to do. There's life to go on, like you don't kind of pay attention.
I didn't feel a thing, which actually scared me even more, because had I not, then
I mean,
I just felt it,
I feel like this is the first time I've ever really sat down and had a conversation about this, because suddenly I'm learning things for the first time. I had no idea that there was more than one kind of breast cancer. And we have 2, by a huge coincidence, we've got 2 beautiful ladies here that have experienced different kinds of breast cancer, which I'm really glad about, because thank you so much for explaining what that means. So you've discovered that you've got, coming back to you, Monika, you've discovered that you've got this breast cancer, is incredibly aggressive, that you've had that conversation with the surgeon who's basically told you, we've got to do something now.
Yeah.
Can I ask you, when you went home that evening and sat around the table and made dinner, what did you say?
To be honest, it's like a flashbacks, like when you pass the time. Like I actually have to close my eyes and think about it, and everything happened so suddenly because they wanted to start the treatment very, very fast. So there was no time to think like, okay, in 2 weeks' time, we want to start you on chemo. And what I was thinking, it was like, obviously everything's like, everyone was supporting, don't worry, everything's going to be fine. First of all, we're going to see like, is it spread or no? If it's not spread, it's fine. Like even the doctors, chemo will shrink it, like think positively. At the back of my mind, I always, when I went back to bed, my heart was racing. I had a cry. I was overthinking things, what can happen. But as a family, we said, whatever happens, just let's keep the same routine and same things, like, so it doesn't really affect us. However, even with my son, older son, he was 4 at the time. So kind of obviously, mommy is going to have some changes, we had to ask, like, how I'm going to tell him. Like, I want to tell him, because obviously he's going to see some things. But yeah, I mean,
Lorinda, can I ask you, because I'm unpacking exactly what these lived experiences are first before we come to what we can do. But Lorinda, when you went home and they've told you it's not just your breast, it's also your lymph node and we need to operate, how did you handle that? You had a newborn. How was that conversation?
I think, like looking back, for me it was just really such a blur because of everything I was going through with my son. And it took me a long time to process. In fact, I think I never really processed it in the beginning because I was in fight mode because of him. So even in the year that I was going through cancer and the chemo, he had 5 surgeries. So for me, my journey was so all over because it was, I didn't have the time to process or focus on me. My pain was more because, okay, something's going to happen, or now I have to go through all of this and he needs me and I want to be there for him, but I can't because I have to take care of myself. So I don't know. I just remember there was like one incident where me and my husband hugged in the middle of my bedroom and I just cried and cried and cried. And he said, I know. And that was it. And then it was kind of not spoken about. And then you just kind of go through the motions. You go to the appointments. You go do the chemo. But I just ran through it because I had to be there for my son as well.
Because we're women and that's what we do, right? I'm sorry, I heard this, Mariella de Meck said this right at the beginning of the She Word. She said, we're women and we just get on with it. And I'm just sitting here, I'm profoundly blown away by any woman who is a mother, let alone a mother with dealing with this as well. So a paramount respect to you. But you said something, Monika, that really stuck with me. You said that you never thought it would happen to you. And can I tell you, I'm sitting here with some amazing, beautiful women here. It's never even crossed my mind that I would be affected, me, Trudy Kerr, would be affected by breast cancer. I never even thought about it. And I'm going to be really honest right now and say, I've never checked my boobs. I have never done that. And I'm going to ask everyone here, gentlemen, bear with us. But ladies, is there anybody else here? I'm going to ask you to be a little tiny bit honest, but is there anybody else who's never checked their boobs? Anybody else never checked their boobs? Yeah, we've got some honest people over here. There's some honest people that are saying, I've never checked. It's never occurred to me to do that. We always think that it's going to happen to somebody else. And this was really impressed on me because when I looked at the statistics, certain factors, and I wanted to find out more about breast cancer, and I'm looking at you, Mariella, because I'm going to ask you for some input into this. But certain factors increase the risk of breast cancer, including increasing age. I am now 50, so I am actually eligible to start having screening, but I've never checked my breasts before. And these ladies were in their 30s when they were affected by both types of breast cancer. Harmful use of alcohol, family history of breast cancer, history of radiation exposure, reproductive history such as an age that menstrual periods begin and the age at the first pregnancy, tobacco use, postmenopausal hormone therapy. Now, I actually am on HRT. I've spoken about it openly, and so I really should be taking more care and a little bit more mindful. But all of these elements, I'm looking at these two beautiful ladies. I mean, I don't know if you smoke or if you drink an awful lot of alcohol. These ladies, the two ladies sitting here and the ladies that we've seen here with us today, don't look like they are sort of listed on here. So I'm going to ask you, Mariella, do we know what really targets women for breast cancer? If we're listening to this, if we've got people listening to this and they can say, okay, that's me, I need to go and check that I've got breast cancer because I'm likely to get it. It doesn't seem to me that it correlates.
Not really. That is why we always speak about risk factors. There are risk factors which you cannot change, like genetics, you cannot change that, family history, you cannot change. Obviously, the start of your menstruation, you cannot change that, or pregnancies. I mean, we know that there are women who have issues to get pregnant, so you can't actually change that. But obviously, there are the risk factors which we can change, like the tobacco, the being very active, the diet that we take, the intake of alcohol. But obviously it has to be, I mean, these factors doesn't only indicate that you're going to have breast cancer, because if you just list all the risk factors, these risk factors are also risk factors for cardiovascular diseases, for diabetes, for the majority of other comorbidities that are not good for our health. Like cancer, it's something that everyone is afraid of, but having cardiovascular diseases is commonest more than having cancer. So I think when we're speaking about risk factors and how our lifestyle should be, we have to be very mindful that it's not just affecting it's wrong taking these because of cancer. It's because you need to be healthy in general, not just for cancer. Another risk factor that you cannot change is age. I mean, we all age, as you were saying, but there's nothing we can do to change that, or sex, being female or males. Males also are affected by breast cancer, it's a very rare, it's 1% of all the breast cancers, but it happens. So yes, even males have to check their breasts, although they're not like the women breasts. So yes, what we suggest is the health promotion, which is what we do here, that we are on this trail, on these campaigns, like the Pink November, that we always tell people that the earliest that you actually know that you have cancer, it's better because the treatment will be much easier. The prognosis will be much better. Everything will be much better, So checking your breast at least once a month should be done by every woman of every age. I have patients who are in their 20s who already have breast cancer. So there's no age which you can say you have to start checking your breast at this age. So yes, you need to know your breasts. When a woman is still in her 20s, 30s, and sometimes even 40s, the breast is so dense that you can't feel all the small lumps that you can have. Or sometimes they think that it's a lump and it's not. So sometimes we have patients who prefer to do an ultrasound, for example. But below the age of 40, mammograms are not suggested because of the breast still being used for breastfeeding and due to childbearing age. But above the age of 40, we have women who prefer to do what we call opportunistic screen mammogram. They check with a mammogram every 1 to 2 years, especially if they had family history. So from 40 till 50, they'll do a mammogram. And then from 50 to 69, women who reside in our country are called for the screening mammogram. But one thing which is very, very important that we mention is that the letter arrives at your home. But if you don't write back and you send it back, you will not receive the appointment.
This is a really good point. And we're going to sort of come to the active that everybody can do and the things that we need to be doing ourselves. And we'll come to that in just a minute. But that's a really good point. You have to actually take responsibility and get involved. But I want to come back to these ladies and I want to ask both of you, Monika and Lorinda, did you ever check your breasts? Did you check your boobs before?
No.
Okay, so you were in my camp.
Yeah.
You were not boob checkers.
No.
Okay, so and you mentioned, Monika, it never occurred to you that this might happen to you. So I want to ask a really human question. When you got that diagnosis, were you not just a bit ticked off? Were you angry? Did you feel angry? Because I know you guys live healthy lifestyles. And Mariella's just been talking about the fact, we've got to live healthy lifestyles. We've spoken about this before. Were you not sort of a little bit like, hey, why has this happened to me?
Yeah, I mean, one of the questions that they asked me was like the usual. Do you smoke? Do you drink? No. Were you ever on the pill? So that's another one and I was, in fact, on the pill. So it's like, I was very angry, but I was taking the pill because of my hormones. So to regulate my menstrual cycle, I had to be on the pill because I was at risk for polycystic ovaries and all that other lovely female stuff that we go through. So they said it could have been one of the factors, So
okay, so I'm going to stop there right there because this is really important. That we have so many young women, so many young ladies, and so many people watching the She Word who do take the contraceptive pill. The contraceptive pill is not just for convenience and so on and so forth. I took it for 15 years for endometriosis. Lorinda is saying that she took it for medical reasons as well. Does that increase the risk?
Studies indicated it doesn't increase the risk of having cancer, but if you're meant to have an estrogen positive cancer, it facilitates because you're actually giving it more of the hormone that it needs to grow. Like HRT, it works the same. But in fact, gynecologists prescribe it. I mean, it's not wrong by doing that. So that is one thing that we have to say, which is very important. I mean, there's no contraindications of, but once we know that there is an ER positive breast cancer, the first thing that we do is that we tell the patient to stop the pill or the HRT or the Mirena. So anything to do with estrogen has to be stopped. Even, for example, the use of facial creams or other tablets that they take or any creams that they use for their moisturizing body, which include estrogen, that has to stop.
So now I think I'm understanding the form of cancer that you had, which is related to estrogen. Estrogen are the markers that did you say the markers?
The receptors.
The receptors that the cancer was attracted to, the cancer was responding to. So in your case, it could have been because of the pill. It could have helped it. In the case of Monika, that's not the factor. I mean, Monika, when you got your diagnosis, I know that you're very active. I know because I follow you. Yeah, you always have been very active. Did you have that moment where you said, why me?
Yeah, of course. I was like, why me? Especially, I was like, why did I do in this world? Why it's me? And interesting enough as well, because I didn't have any family history, but then after my treatments, I was referred to do the genetic testing. And from the genetic testing, it showed that I had BCRA1, which is a triple negative mutation thing. So basically, whoever has that gene has a higher risk to get this kind of cancer. But you would never know it because you wouldn't go and do genetic testing out of nowhere, So then it kind of made sense. I was like, okay, just because I have this gene, probably, the cancer came out.
Perfect storm.
Obviously. But yes, anger is always was there, why me? Yeah.
I love where'd you go, what you do, how the hell you made me fall in love with you, and then you leave, now you're gone, all I got is this damn song, so I can feel, but I can't touch you, said my love was a bit too much.
Listen, I remember something very clear that you said to me, Lorinda, when we had this conversation back in season 2. We talked about other reasons, and I'm going to ask Mariella for your thought from a medical point of view about this. We talked about, and Alison Kelly also said the same when she came on the show about grief, that she was going through a grief process, and she believed that her grief had been a contributing factor to her getting breast cancer. And I remember very clearly on the season 2 show, you mentioned that you were going through a great deal of challenges with Henry, your absolutely gorgeous son, and that you believe this might have been a factor to it.
I believe that because, and then like Monika, I also did the genetic testing, but I had nothing, and there was nothing to predispose, and they said, no, there's, no indication that this was in your genes or anything like that. So it gave me more of this kind of reason to feel that it was very much stress related. I believe that it is very stress related.
See, when you say stress-related, suddenly that makes a bit of sense because so many medical conditions can be expounded. It can be made worse from a stress-related situation that you're living through. Am I right? Am I wrong, Mariella? There's a face there. Mariella's like...
I don't think from the medical point of view. I mean, we're more angry with... because we have so many young patients who have been misdiagnosed because of the word stress. So they'll always tell them it's because you're stressed, you're feeling this, it can't be. So, I mean, stress can be the cause of many things. I think it's more of a psychological thing that you actually don't be much checking what you need rather than, like Lorinda was saying, she was focused on her son, which at that point in time, I mean, nothing would have come in her mind, like probably most of women will do. But it's not related to, I mean, that stress is going to cause cancer, but being healthy mind in our mind psychologically, it's like being healthy in our body as well, so we're it's a bit difficult to...
I think for us women, I think most women agree, our lives are stressful.
Yes,
and then particularly, anybody got a stressful life? Anyone? Anyone? Yeah. Anyone think they're under a bit of stress? I love the ladies that didn't put their hands up. They're like, no, we're great. We're really chill. We live a stressful life these days, and stress does have a physical impact on us.
Yes.
And I'm just wondering if because I've heard this twice now with breast cancer survivors, that they were in a stressful situation at the time, whether or not that may just accelerate or contribute to, maybe not a causing factor, but maybe it just doesn't help.
No.
This is like when we have patients who tell us, but I've lived a very, very, very healthy life. No smoking. I actually know what I'm eating, and it still happened. How did it happen? I mean, it doesn't mean that if you're super healthy, it's not going to happen to you. I mean, it's not if, but when.
See, this is what I'm taking away so far from our discussion, is that breast cancer is indiscriminate. Yes. It can really affect anybody of any age at any time and any stage of life. As you said, Monika, that you have a genetic disposition, but you weren't to know that. And that also it can be incredibly fast. Mm-hmm. So you can go from nothing to a very serious diagnosis in a very short period of time. But before we come to advice of what we can each do, and we'll have some questions as well, I do want to just ask, because this is really important, and I want to thank Chloe for this. The title for this podcast is More Than Just a Diagnosis, which I think is incredibly important, because you and the two lovely ladies here are breast cancer survivors. So there is the diagnosis, there is the treatment, there is the frightening journey to go through, but you come out the other side. And I want to be positive about this. And you just smiled there, because what have you taken away? What can you, Lorinda Mamo, who speaks out about this all of the time and is such an absolute joy to be around when you talk about this, what have you taken away from your journey that's been positive? What did this journey do for you positively?
Grab the bull by the horns and just do it. There's no time to wait. As you heard Monika saying, the journey is quick. And I know that people are more fearful and they don't maybe get checked or they don't ask. And I just always tell people, if you are worried or have any doubt, go and check, because the alternative is far worse than that fear. So for me, it's just like, okay, I'm going to do it, and I'm going to do it now, and I'm not going to wait. And I think that I've learned, it's taught me a lot to not like sit back and wait for things and just go, like plow through.
You're echoing something that came out in the last week's show. We had these three amazing, it was the Young Women's Edition, a fantastic, amazing show. 2 cancer survivors and a young lady with endometriosis. And the young lady with endometriosis was turned down over and over again and told, no, you've just got bad gas. I can relate. That was my story as well. She said, I had to be persistent. I had to just say I was going to get treatment. I'm going to do something about it. And echoing, and these young ladies are in their 20s, for goodness sake. I wish I had learned that in my 20s, to be more persistent. Mm-hmm. And if your body tells you that something is wrong, do not give up. Get your answer. Yeah. Monika, for you, I love it when you smile. You've just got such a great smile. Is there something positive that you can take away from your journey? Because you are a breast cancer survivor, and that is worth celebrating anyway.
When I look back now, I have to think back about it. But the positive thing out of this, obviously, like, you don't realize how strong you are, and after going through that journey, you feel like, you know what, nobody's gonna break me. If the cancer didn't break me, like, bring it on. Like, my attitude is like, bring it on. Yeah. Like, there is nothing I cannot do. But in the same time, I'm a pretty shy person, so going through it, I felt really lonely, even if you have a support, with the family, with everyone. I felt lonely because I didn't have a community of the people going the same. I don't know anyone, no family, no friends, nobody going through the same journey. So even if you share, everyone's supporting, everything is going to be fine. But people who don't go through it, they wouldn't know it. So out of it, I took a courage. First of all, I was like searching online for the groups, breast cancer survivors, things in Malta. I couldn't find anyone. Then I joined the American ones or whatever, And then I started sharing things on my social media, very little, but I said, you know what? Because I wanted, I had so many questions, and sometimes I felt like the doctors even don't get me, you know? So I started doing research and sharing things online and stuff. And out of it, you know, people, even, it wasn't a group of people, but a few people who reached out to me. We have one, Davinia, when they reached out to me and saying, hey, I'm going through the same stuff, you know, like, thank you for sharing this. Where did you get your wig? Where did you get that? And it just gave that positivity, like you share things, you empower people, like, hey, it doesn't have to be bad. Like, I don't have, how I say it, like, I didn't want to look, I'm sick, or like my world is falling down. I had 2 young children to look after. I didn't want people to feel pity for me, like, oh, you know, Miskina, she's sick, or 2 small kids, you know, like who didn't know me personally probably wouldn't know that I went through cancer. When you look back, like, I dropped kids to school every day. I was at every birthday party, activity, everywhere, you know. I wanted to be me. I didn't want cancer to define me. So I think so out of all this experience, which was really tough, this came out, you know, like I kind of find the voice to talk and encourage people. Like, and I say, like, you know, like even it's just one person who is shaky and don't know what to do, like just text me and call me. I'll give you a website of like where to do stuff, where to find stuff, you know, because it's hard. Like I've been there and it's hard. There is not much. There are like even doctors I know they are supporting, but like because they are not going through, like sometimes like even about the hair, you know, it's okay, it's gonna grow up. I know it's gonna grow back, but like, what can you do for me now? You know? So yeah.
You got me really choked up, Monika. I really am, because just your positivity and how that has shaped I've heard Lorinda talking about it before, and when she talked about her journey the first time, I was in bawling my eyes out, and you've got me choked up again, because to have this positivity,
not just positivity, I think,
just to be able to say, you know, you said cancer doesn't define me, and this is, again, this comes back to the title that Chloe suggested, which is it's more than just a diagnosis. I'm so thrilled, and I'm so honored to be on the same stage as you ladies. I really am very humbled. I want to come to you, Mariella. Let's talk about some practical things before we take some questions.
Yes.
Okay. So us ladies that have got boobs, how are we going to self-examine? I want to walk away with something really practical. And we're talking to the whole of Mercury Towers here. So if there's anybody listening around us, we're going to tell you how to check your boobs. How am I going to go about doing that?
So first thing one should do is stand in front of a mirror.
Okay.
Get to know your body. How does it look like? But by looking at it, not from on top. Okay?
So we're standing. Could you see my face? I'm like, wow, I wasn't expecting that. So we're gonna stand there,
and you need to see how you look, but you have to do it naked, like without any bra.
Okay.
Okay.
I love you. You're so cool. So we're gonna stand there in front of the mirror.
Yes. So first of all, you're going to put your hands on your side.
Okay.
And obviously, you're gonna look at your boobs.
Okay.
And you're gonna put your hand up. Okay, always. And you're going to see the change of your skin in your body.
Okay, I'm actually going to stand up. Unless we have to do anything too intimate, I'm going to do it. I'm not taking my clothes off. Mercury Towers, you're okay. But I'm going to put my hands up like this.
Yes.
And so I'm standing in front of the mirror.
Yes.
I've got nothing on. I'm doing this.
Yes.
Okay.
And you're going to put your hand here.
Okay.
Okay. And then you need to look at your boobs. So if you're going to see any dimples in the skin, that might be one of the signs.
Just dimples, like...
Yes.
Okay.
Yes. Because that is not obvious when your boobs are just lying down. So when you're putting up your hand, your chest wall muscle is pulling the breast.
Okay.
That is why it becomes more visible. Okay. Then with the right hand, you're going to check your left boob.
Okay.
Okay. And you have to go around all the quadrants, we call them, of the boob. So we do it in 4, okay. Right? Like a cross. You start from the top one, all right? The upper outer one.
Okay.
And you're going to go in circles around your breast.
This is not what I was expecting to do this afternoon.
Yes. And you're going to use your 3 fingers like you're doing. Because
fingers.
you can really feel, okay? And you're going to go around until you end up at your nipple. So you're going to check even behind your nipple, because some of the lumps can be behind the nipple.
Okay.
And obviously you're going to do the other side. This is ideally also, it can be done under the shower.
Okay.
So in front of the mirror or under the shower, because you have soap as well.
Right.
So when you use soap on your fingers, your skin will become more easy to...
Ooh.
Yes. In fact, even sometimes in babies, they'll tell you when they're young, the ideal thing to do is you wash them with your hands, not with the brush or anything.
Okay. So we're doing this. We're going to stand. I'm going to reiterate this once again.
In front of the mirror.
Mirror. Okay.
With your hands beside you.
Like
and
this.
you'll pull up your hands.
And
you're
looking.
And you're looking at your breast.
Okay.
And you put it behind your head. Okay. Then with the other hand, you're going to check the left side by going around in circles until you end up at the nipple. Okay. And obviously,
like a spiral from the outside,
yes, it's like
heading
a
in
circular movement.
Gotcha.
Okay, and you can do this also under the shower with soap, and you have to check the other one and even under your arms, because sometimes the first sign will be under the armpit, which is the lymph node that Lorinda was.
That's what you were mentioning.
Yes.
Okay, and so how often are we doing that?
Once a month.
Okay, so I need a helpful tip here. Is that something that we're going to be putting on the calendar?
You take a shower every day. No?
Yes, I do,
You don't
Mariella.
have
Yes,
excuses.
I like the way you're looking at me. She's going, does Trudy shower once a month? No, I do shower every day. That is absolutely true. But it's the sort of thing that I don't know about you guys. I'm going to ask everybody here. Does anybody have a difficulty remembering to do that? I am so forgetful. Anybody else here? Everyone's like, I'd forget to do that. So it's helpful here.
I would like to mention as well, the campaign that we're on at the moment, we have given leaflets, which I think they were spread around the shops, which they actually have how to check the breasts and obviously in males, other cancers. Okay. So that is very good.
Let's say, like these ladies, I find something that doesn't feel right. Mm-hmm. What am I going to do?
So if someone feels a lump, obviously they have to go straight away to their doctor. So it's either a GP, a general practitioner, family doctor. They will do a ticket of referral to hospital. Okay. There is also the system of fast track. So they have the referral system can be fast tracked to the breast clinic. So they'll start the investigation right away. They'll do the mammogram, the ultrasound, the biopsy, all in one sitting. So we can, so the process is very fast. Otherwise, there are people who prefer to go privately. So they can book an ultrasound or a mammogram. It depends on the age. Okay. Obviously.
Okay.
But yes, and as Lorinda was mentioning before, if you feel that your body, there's something wrong, whatever it is, even if you can't really feel it and it's so obvious, just keep on pressing and like telling them, no, I think something is, if need be, change doctor. I mean, we have loads. But yes, listen to your body and what your mind is telling you, because usually you're right.
Brilliant. I really appreciate that. And we'll have obviously links and connections underneath this podcast, like we did a couple of weeks ago. All of your numbers and email addresses and websites and everything will be underneath this show. So I'm coming across to ask, does anybody here, Chloe, our gorgeous, gorgeous lady, is going to come with a mic. Does anybody have a question? Does anybody want to ask either a technical question or something for these ladies on their personal journey? Anybody have a question? Everyone's always really, really shy.
Okay, so it's a question for both of our wonderful survivors. I'd like to know how you celebrated when you found out that you were cancer-free for the first time and started the rest of your healing journey.
What a great question.
I didn't celebrate. I think I was in the hospital with Henry.
Wow. I feel like we should all get together and take Lorinda out for a dinner for a belated celebration. Hands up if you're in for that. Yeah, everyone's coming to take you out for dinner. Wow, of course, because you have an awful lot of other things going on. But for you, did you celebrate, Monica?
Yeah.
There's a story there.
Actually, to be honest, it was a funny story again. So I had to finish, I had my surgery in, if I'm not lying, was May. And then I had to start radiotherapy, 2 weeks of radiotherapy. And it was end of July, I believe. And it was out of COVID times because when I was diagnosed was COVID time. So traveling wasn't really an option. So COVID finished and I said, you know what, I'm going to finish this journey, radiotherapy and everything, and I'm gonna go on holidays. And we're planning a big holidays, actually, out of Europe to go, a big family holiday. I was really, really looking for it. And then it was a little glitch in Mater Dei going on with radiotherapy at the time. The machines got broken or was something going on. It was actually, I was in the middle of radiotherapy. So they had to decide, like, is it enough for me? Or if I have to continue, I had to, like, they were transferring patients to go to Rome and stuff. For our holiday, everything was booked. And I was like, no freaking way, I'm missing this holiday. I'm like, I'm not going to go to radiotherapy. I'm going to the holiday. I missed few, but then it got fixed or something. So it managed. So I went on holiday. I went on a really nice holiday with the family. And then this is what I call my kind of award from all this journey. It was that I got pregnant just after my radiotherapy. So we came back from holidays and I found out that I'm pregnant. So I have my baby girl.
What a way to celebrate. What a great question and what a great answer. Absolutely.
Take care and enjoy good health. Browns, empowering wellness by providing convenient and innovative health services.
Do we have any other questions? There's a beautiful lady here. Yes.
Hi. I wanted to ask these wonderful ladies here. When I was diagnosed and I was talking with friends and family, I personally found it really challenging to know, to get the responses from them. It wasn't how I thought it was going to be. And I remember my sister saying to me, well, what do you expect people to say? And I thought, well, that's actually, or what do you need people to say? And I thought that's a really interesting question. What do I need people to say? And I wondered and I had spoken to professionals about this, and they say it's very common for your friends and family to sort of almost not acknowledge or sort of not really sort of, because they don't want to acknowledge that you're ill and they sort of want to bypass it and sort of not really sort of deal with it in a way, which isn't helpful to you. It certainly wasn't to me.
Well, can I ask you a question before you guys answer? Can I ask you a question? As a breast cancer survivor, as somebody who is going through that journey, what would it have been helpful for someone to say to you?
Okay, so I think I would have just liked them to have acknowledged.
Wow. Now, can I ask you something else? Was this here in Malta or was this in the UK?
No, this was here in Malta.
Wow, okay. Because I know that British people, we don't handle that sort of news very well.
But can I also say, I had all my treatment here in Malta. I started off privately only because I had the expats insurance. But my treatment at the private hospital and at SMOC, the Anthony Mamo Centre, was absolutely amazing. All the staff were fantastic.
Oh, that's amazing.
And care that I got from every single person. My surgeon, my radiologist was amazing, and the radiology team and everything, fabulous. And also the team I believe you work for was brilliant. You know, the nurses that you go and see every week when you're having a treatment. And also I went for a recent meeting for the survivorship team, which is for people that, you know, if you don't process your, like for Lorinda, for example, you don't process your journey because one, you haven't got time, because other things take, you know, they're in the way, etc. But also because you might not be ready to.
It's super
fabulous.
Sorry, and it's really encouraging to hear for anybody who is sort of like me, probably even nervous to check my boobs just in case, but that journey was really positive for you. I'm really glad. And you just wanted acknowledgement that something was happening. Well, let me ask you, let's pose this question to you ladies. Apart from anything else, what did you want to hear? Just as this wonderful lady asked.
For me, it was a bit strange because I remember going to the doctors and everyone's like, sorry for the like pussyfooting around. And no one would actually say, or no one said to me, you have cancer.
I remember you saying this before.
And I was really taken aback and it made me very angry. And I didn't know. I was angry at the time, but I was like, but why don't they want to actually acknowledge or say, you have cancer? I mean, I still to now, I'm like, I don't know how I feel about that, but it was it's like, you know, you have a cold, you have the flu, you have diabetes. No one would say you have cancer until I actually confronted and said, do I have cancer? And then they said yes. On the other hand, there were family members who said, when I told them, they're like, okay, we don't speak about it now. We don't talk about it. And I was like, no, I didn't do anything.
Wow.
And it was very hard for me also to like process this big thing that was happening to me when people were not saying what I had and people telling me to hide it.
Can I ask you, Monika, because you mentioned loneliness before.
Yeah.
Is this part of the loneliness? Oh, and I want to come back to ask you as well, Lorinda, and really get to the nitty gritty. What is it that I could say to this beautiful lady, to this other lovely, amazing lady here? What, as a friend, could I possibly say?
First of all, thank you very much for the question. And I totally understand what she's saying. Like, it's so common. I think so. It's so common, but I don't know the answer, to be honest. I don't know what I would want them to hear, but as the lady mentioned in the audience, from my friends and family, it was as well kind of, they didn't acknowledge it, like, okay, you have cancer. It's okay. Like, we stay normal, you know, like the life goes on. Yes, I know life goes on, you know, like, which helped. I'm not saying anything, which helped to have the routine, like, my kids were the force to get me up in the morning and keep it going and doing, you know, stuff. But in the same time, nobody with me talked, or we never discussed, like, what if I don't survive? Like when I look back, like, I feel I wanted that conversation, you know, I wanted someone to tell me, like, listen, you're going to go through the treatment. I'm going to be here. Everything's fine. But, you know, don't worry. Like, I used to be alone and have those thoughts on my own. Again, I don't expect people not going through the same journey would understand me. But the biggest, not mistake, but I think so the biggest thing, I saw it afterwards. As we push it away, I pushed my feelings away. I pushed everything. It's like I just concentrated that I have to go through chemo. I have to do this. Life goes on. Now, after I didn't take therapy during the chemo. I know the help is offered, but I was fine. I always defend as I'm okay. Even when you go into meetings, the nurses will come and, like, if anything, if you need to talk, you know, babysitting the kids, anything they would tell you, like, just we are call away. You know, that's so helpful. But from my side, I was fine. I'm okay. Like, I'm handling. And I felt okay, you know. In reality, I wasn't. So only after I finished my treatment and I started therapy, I started therapy not because of the cancer journey, because of my separation. I started going through the therapy. And obviously we talked about the previous experiences. Then I realized how much weight I put on myself, how much I carried on my own, because I wanted to be a burden. And I felt like they don't understand it. Why would I talk about, how hard it is to go there? So this, like, they wouldn't understand it. I felt uncomfort finding the friend who goes the same. Like we're going the same in the therapy, in the chemotherapy, So I found the comfort there, but not with my family or friends. And it's hard, yes.
Mariella has been nodding away as you've been talking, and I'm going to come to you in a moment, Mariella, just for some advice. But I just want to ask, I'm going to push again. You know me, I'm a bit persistent. I'm your friend. You're my friend. If you come to me and you say, hey, Trudes, look, I just want to let you know I've got a cancer diagnosis. I've got a breast cancer diagnosis, Trudes. What do you want me to say? What can I say to you that's going to be the most helpful?
I think so. I wished nobody would know it. But now I would say, like, if you have any friends who go through it or family members, I would tell them, please take professional help. Okay. I would say, like, have you been to the therapy? Have you started the therapy? Have you talked to someone who is actually can understand you and work with your feelings? Because friend is a friend, like, it's different. They can comfort you. They can support you with the words that everything's going to be fine. If you want any help, when you have chemo, I can cook for you. As a friend, you can do these things. But emotional baggage, I think so. It's pretty lonely journey. Like, it is lonely journey. Like, I think so. I feel it. So I wish whoever has any friends or family members, they will encourage that person to seek for.
This is brilliant help. Brilliant advice.
Don't be stubborn, or don't put away, because I'm busy or I have other things to do,
Okay. Lorinda, you've just told me your diagnosis. Yeah. What do you want to hear from me?
Just that you'll be there, no matter what I need, even if you just sit in silence, because I pushed everyone away, but at the same time, I wanted just someone next to me. Not even needing to say anything.
I think that, again, brilliant advice. I'm getting choked up again. Mariella, you've worked with a lot of ladies who face this challenge. What would your advice be to them and to people who care about them?
I was very impressed, and I loved to see their reactions when this question was actually asked. Because for me, from the other side, which I'm not a cancer patient myself, but I've seen hundreds of them, I truly agree with Monika. At that point in time, all women will be just focused. Let's start the treatment now. I want to get it over and done with. I want to do it. They'll be so into it. But then their emotional aspect will be just put back in their mind. They put it there in the corner. And as the lady in the audience was saying, then after all the treatment finishes, they're like, now what? No more appointments, no more meeting up with nurses and doctors in hospital. Now what's going to happen to me? They left me alone. So yes, the psychological help should start from the beginning, not at the end of it, because then, it still helps, but it will be much harder to go back through your journey and to really focus and try to find what actually was bothering you or why you didn't talk about it. And yes, talking about it with your friends and family is one thing, but talking about it with someone who you don't actually know and they professionally know how to ask you the right question. Because I have a lot of patients who tells me, it bugs me when someone comes and tells me, how are you? Like, how can I be? I'm having chemo. It's not nice. So, that it's just a very simple thing that we ask without even thinking. But for that person having treatment or going through treatment and another issue in their life, that could be the tip of the iceberg, that you literally burst all their emotions. So when I see patients after they finish treatment and as they're going through treatment, the first thing I do is just hug them. That is I know that there are people who doesn't like it, it's like, why is she hugging me? But sometimes it's better to show your emotions with non-verbal communication, because I say, if I'm going to say something when I'll be verbal, probably I'm going to do it wrongly or say the wrong words. So when I see them, I'll just go there and I'll just hug them or put my hand on their shoulder and I'm like, hug them from the side, and I'll just look at them. As soon as I do that, they either start crying and I was like, okay, what happened? And then they'll start off. So yes, but that is because we work with patients. It's not, it's not a friend. It's much harder to do that with you because she knows that she's going to cry as well. So she feels like I'm not helping her if I'm crying more than her, So being, helping someone who is close to you, it's more difficult. In our case, we have emotions, we do, but we're learned how to keep our emotions back. So what I always say, sometimes even myself, I'm like, but why can't I cry in some situations? But actually, then if I really reflect on it, it's not because I don't have a heart, but it's because I know I'm there to support them, not to just look at me and they'll see me cry only. I'm not there to cry only, I'm just there to support them. So yes, and the lady was mentioning the survivorship team. In the directory that I work with, we have this survivorship team who see the patients after they have finished off the treatment. So first, we are the ones who are taking care of the patients, and then they are referred to survivorship team who do this clinic, which is called Holistic Needs Assessment, with who they go through loads of questions which you don't even think about, even myself, with regards to sex, therapy, everything, because cancer affects everything, not just psychological, So sometimes it's just shy to go up to someone and tell them, because listen, I have issues with my sexual relationship, So my husband is not liking my new me, I'm having treatments and I don't feel like it. So there are much more issues that we'll just brush it off, So
I'm so glad you mentioned that, because you're making me think about one of the shows that we had about successful sex. We've had quite a number of shows on the she word. Go back and have a look because they're brilliant. But Anna Catania mentioned that if you have gone through a trauma like cancer, like an illness like that it does affect, and it can affect. And exactly as you've said, talk about it. You mentioned, when you mentioned hugging, these two ladies were like, yeah, they were nodding away. I saw you. We're going to have a big group hug at the end of it. I can see a lot of love in the room. I think we have one last question. Oh, my word. We have a question from Henry. Henry, tell me, what do you want to ask?
At what point in your cancer journey did you realize that, for this period of time was going to be tough?
Wow. What a question. I'm going to let Monica answer that first, because Mum's got a bit of an advantage and it's so great to have Henry here. Well, what point did you realize, okay, this is going to be tough?
I think so. The toughest thing for me, everyone takes it differently. I handled the chemotherapies and another treatments which I had to go after chemo pretty well. So for me, the toughest, where it was my, breaking point after the first chemo. After the first chemo, they said, when I asked when is going to be the time I start losing my hair and stuff, they said something after first chemo, and it started very, very fast, and I didn't expect that it's going to be so fast, and I prolonged it very long time. Everybody said, when it starts falling, just shave it. I didn't. I used to wait. I used to not to go to shower to wash my hair, because if I wash my hair, they just start falling. So I just go to shower, wash myself, and don't wash my hair. So at least I put a hat, and I have some, they were starting losing hair. So the hardest point, the toughest point for me was shaving my hair and losing it and saying, okay, now it's real.
Wow. Lorinda, for you, your son asked this question.
Yeah, to be fair, he asked me that last week, I think, and I couldn't answer, and unlike you, when my hair was coming out in the shower, and I asked my husband to shave it, and he stood over me, he's like, are you sure? And I was like, do it. The hair was the least of my worries. I think my breaking point was, after the first chemo, when I felt like, it's like when in the movies, you're nauseous and weak, and it's just like everything's, and I said, oh, this is going to be hard. I mean, mind you, then when I told them that it was so bad, the first chemo was so bad, then they adjusted the medications and it was okay as they could. But it was then, I think, that I said, wow, it's unbearable, really.
I want to say thank you very much indeed, Henry, for asking that question. I want to say, ladies and gentlemen, we're going to wrap up in a second. Whilst I'm just kind of closing, I'm going to ask you guys to just offer a closing thought. And I want to end on a positive note. I want to say thank you so much for being so honest about your journeys, but also offering so much hope. You guys have had me really choked up. And Mariella, thank you so much for the advice. I'm going to be watching this myself and doing this quite frequently from here on in. But I want to just get you to think of one sentence just to sum up your journey to leave this show today. I want to say thank you to everybody that's joined us here. I want to say I have so much admiration for breast cancer survivors. I'd like to have another round of applause for both in the audience and also here on the stage. Thank you for speaking up. Thank you for being here with us. And thank you for making a difference. Thank you to Mercury Towers as well. Thank you to Chloe, to Owen, and everybody who's been behind this show. What we want to achieve today in this edition of the She Word is bringing awareness to a topic that I personally knew nothing about, but affects every single one of us in one way or another, whether it's personally or someone we know and love. And thank you for the advice of how we can be the best friend. Thank you for asking that question, because I know that I want to be a better friend to somebody who's going through this journey. Closing thoughts. I'm going to start with you, Mariella. Thank you so much for being with us. Thank you for what you do. Your closing thought?
So my closing point would be, first of all, to do the checkups and know your body very, very well. To accept the screening letters once they arrive at home. Please send them back. Otherwise, you won't be called in for the mammogram. And to help out in the campaigns that we are doing, we have introduced the outreach project, and they have provided us with the vehicles to start the process. And we are starting to go to the people's home to give chemotherapy at home rather than having some patients come to hospital. So, yes.
I feel like I could talk about this topic for at least another 2 or 3 hours, because there's so many more facets to this, and we will come back to this topic. But thank you so much for being here. Thank you for everything that you do.
Thank you for the invitation.
I really, really appreciate. Monica, your closing thoughts. You look gorgeous. I have to say, I want to say once again, you look absolutely stunning. Thank you so much for being here. Closing thought.
My closing thought. I don't know, to be honest, cancer is such a unique journey, and every cancer is unique and different, and everybody takes it differently. So it doesn't matter if I've been strong through that, like everybody can be the same. So I think so the mindset and positivity, this is what helped me through. Positive thinking, mindset, and just whoever is going through it, or even listening to your gut feeling. Let's start from the beginning. Like, if you don't have a cancer, if you don't know it, first of all, as everyone has said, if your gut feeling saying there is something wrong, just go and check it. First of all, don't delay it. Don't do my mistake, please. If you make an appointment, go on appointment. And just out of it, just keep going, just keep going and think positively. Like everyone can go through it. Everyone,
Fantastic.
and you're not alone. And there is so much help out there. You don't have to feel alone. You will find someone, even just one person.
Thank you. Thank you. Lorinda, you get to finish the show. I know. You hate me for doing this. Every time we sit down, you're like, don't make me finish the show. Over to you. Your last thoughts.
So I think for me, in the moment that I was in it, it felt like the darkest time of my life. But looking back, it might sound strange, but I was the happiest because it really made me see how beautiful and wonderful life is. So we maybe complicate things or make things like we think we need a lot to be happy. And in reality, it really put things into perspective so much. And like Monica was saying, it shifts your mindset and you just automatically see things in a positive way, even though you're going through the darkest.
Wow. I wasn't expecting that. Ladies, thank you so, so much for your thoughts. Thank you ever so much for being here. We will have all of those numbers, contact details right here under the show. Whether you're listening on Spotify or watching on YouTube, we'll make sure that you have the contacts that you need. If you're facing a diagnosis, you are more than a diagnosis.